This is not your average mental health channel. I'm Dr. Efosayaro here, Dr. Air. I'm a quadruple board-certified psychiatrist with over 20 years of experience. I've treated thousands of patients struggling with anxiety and other mental health conditions. And here's what those 2 decades taught me. Our traditional approach to mental health has a serious blind spot. We keep writing more prescriptions without ever asking why the anxiety is there in the first place. Here's something that might surprise you. During my training as a psychiatrist, both in the UK and in the US, we were always taught to roll out organic courses before reaching for a prescription. Check the thyroid, check iron levels, check micronutrients. That was standard. That was the baseline. So let me ask you something. When was the last time your psychiatrist or mental health provider actually did that for you? Have you ever had labs run to look for the root cause of your anxiety? Most people haven't, and that gap between what good medicine looks like and what most people actually receive is exactly why this channel exists. Because anxiety is not just a brain chemistry problem. Yes, medications can be game changers. I prescribe them, I believe in them. But think of medication like a cast on a broken bone. When your leg is fractured, you need that cast. It holds everything in place while healing happens underneath. But here's the thing. The cast isn't the healing. Your body does the actual repair work. The cast just keeps things stable while that happens. Medications work the same way for anxiety. The real healing, that comes from addressing what's actually driving it. Things like chronic inflammation, gut health, mitochondrial dysfunction, insulin resistance, and hormones. When you address those root causes, something remarkable happens. People go on fewer medications, smaller doses, and in some cases, they can taper off entirely. I had a 46-year-old patient whose anxiety was through the roof, despite being on multiple medications. Turned out she was deficient in iron and magnesium. When we corrected that, she became the best version of herself. That's the kind of medicine I practice, and that's what this channel is about. Here, I'll teach you the science behind anxiety, how to reduce it, how to treat it smarter, and how to get back to feeling like yourself again. We'll cover psychiatric medications, how to taper off them safely if necessary, supplements, root causes, and the lifestyle strategies that actually move the needle. No shame, no judgment, just clarity. Whether you're on medications and want to understand them better, or you're wondering if there's more you can do, you're in the right place. Subscribe and join me here every week. Real answers, real science, real recovery.